in Samate, you will all agree with me that we have witnessed countless number of such presentations by the Embassy of the Republic of China in Banjul to the government of the Gambia, and especially to the Ministry of Health. This particular occasion is special in the sense that we are braced up in the fight against the prevention of a global disease that has just emerged, and the entire world is working towards its prevention, and therefore all efforts are being done to make sure that the spread does not continue, and wherever there is a case, it is resolved as quickly as possible. This particular outbreak, known as the coronavirus disease, started from the Republic of China, and therefore it is imperative that all hands are put on deck to ensure that there is global effort to fighting the outbreak. So we are very much grateful and thankful to the ambassador and the government and the People's Republic of China for this magnificent donation being witnessed here today. On behalf of the Ministry of Health and on behalf of the Honorable Minister of Health, Dr. Ahmad Lamin Samate, and indeed on my own humble behalf, I wish to welcome you all to this handing over ceremony, and I thank you all for your kind attention.
Thank you, PSJT. This shows that now we are all welcome to this beautiful complex known as the Central Medical Stores or the National Pharmaceutical Services, although we have the Alkali here by the name Alhaji Babanin Sabali. He's the head of the village. It's a nice village, but I'm sure we are all welcome to this wonderful village who is headed by Babanin Sabali. I now have the honor to invite Honorable Usman Silla also to make a statement. Honorable Silla is the chair of the National Assembly's Select Committee for Health, Women, Children, Disaster, Humanitarian Relief, and Refugees. I think I can be able to remember it now. Thank you.
Thank you very much, Mr. Moderator, Mamadou Njai, the Director of Health Promotion. Honorable Dr. Ahmadul Amin Samate, the Minister of Health. Ambassador Ma Jianchung, representing the People's Republic of China in the Gambia. His Excellency, Dr. Desta Turine, the WHO representative in the Gambia. Mr. Jaite, the PS Health, Dr. Bitey, Director of Health Services, and all the directors present here, officials from the Ministry of Health, invited guests, the Chinese team present at this auspicious occasion, staff of the Ministry of Health, and the members of the press. I feel honored on behalf of the National Assembly Select Committee on Health. It's a long name, but here I'll just limit it to health, since it is a health function, to be invited to this very important occasion, which is meant to formally hand over medicines and medical items to the people of the Gambia through the Minister of Health from the government of the People's Republic of China. China has once again done it in coming to the aid of Gambia. This is one of the many interventions, particularly to the health sector, from the Chinese government to support health services. We're very pleased, and I just want to mention the special relations that exist between the two institutions, that is the executive, represented by the Minister of Health, and the legislature, represented by the Select Committee on Health. And I can tell you, this is a very rare relationship in this country in terms of the executive and the legislature. Here is a committee that really stands by the sector. We've been supporting it in terms of our legislative responsibilities, also in terms of being representatives of the people. And the support is not only, like I said, official, but we are doing it with passion. Every member of the committee supports the sector. And my presence here is a manifestation of that support that the committee is giving to the health sector. So we are with you, Honorable Minister. We are with the officials of the ministry. We stand by you in your efforts towards ensuring that every person in the Gambia has access to quality and affordable health care. And all these efforts, all these interventions are geared towards that. I'm just coming, this is a solidarity message, it's very brief, that we stand by you. We are giving you all the support, and our presence here to Honorable, Your Excellency, Mr. Ambassador. My presence here is to show you that we really appreciate the intervention you have given to the Gambia through the Minister of Health, and we are very supportive of it, and to assure you that wherever you may need our services at the level of the Assembly in terms of supporting the health sector, we're always available. And thank you for this very important support in the form of vehicles, medicines, and medical items. On that behalf, on that note, I thank you for the invitation, Honorable Minister. And then congratulations, the Minister of Health. Congratulations to the people of the Gambia.
Excellent statement by Honorable Usman Silla. And to inform you, the Honorable Minister of Health, Honorable Ahmed Lamun Samate, really recognize the efforts and the work of the National Assembly Select Committee on Health. And in this regard, he's always talking about that particular National Assembly Select Committee, and also particularly you, the chair of that particular committee. And he's always emphasizing that in all our interventions, you must be central in it and your team. And inviting you here again also is a clear demonstration that the partnership between the legislature and the executive at the level of the Minister of Health will certainly be strengthened. And thank you for coming, despite the fact that you are very busy. But when you are called by the Honorable Minister, you wasted no time but to answer to his invitation. This is a very, very welcome idea to the Minister of Health, and we are very happy that you are with us here today. Before the Ambassador, His Excellency Ambassador comes in, we have to give a bit of a background as to how these vehicles are available. When Minister took up office, Honorable Minister, he felt that there is a need for us to bridge the health inequity gaps. And how can we do this? Is to ensure that we strengthen service delivery from this, moving it from central level down to the regional level, to reach out to the most, to the communities that are really far away from areas that they can be able to access services. And he has been thinking, how can we achieve this? We have the medical doctors, we have the nurses, We have the various specialties within the hospital in EFSTH and Canifing. Now, how do we get them now to go into the field? Perhaps I need to get something for them. That is to get a vehicle, to be able to transport them, and they go to, for example, URR, do services, build on whatever services are available there, build on those ones, at least once in a month, and come back and then go to another region again for another month. And this is exactly what he had in mind. And he said, okay, I will approach the Chinese embassy for transport. And today, we have been provided with transport thanks to his request. And there are two vehicles, one for health service monitoring and the other one for the medical team that are supposed to provide services to the various health facilities across the country. I think, Honorable Minister, we have to thank you very much for thinking to serve people in the rural areas. We all know we are all from the rural areas, and most of our services have been delivered at the central level. But you thinking that there is a need for us to go and meet out those people who cannot be able to pay transport to come to Banjul here, I think this is a laudable effort. We have to thank you very much for that. And then also the Chinese embassy for supporting. I now have the singular honor to invite His Excellency Ambassador Ma Jianchung to give his statement on this important occasion. Your Excellency, welcome.
Thank you. Honorable Health Minister Dr. Samad, Honorable Namsila, Chairman of the Selected Committee on Health, Women, Children, Disaster, Humanitarian Relief and Refugees, Permanent Secretary of Minister Health, Mr. Jetty, WHO Country Representative Dr. Dester, EDC Program Manager Mr. Sambu. Dear friends, ladies and gentlemen, good morning. I'm happy to attend today's handing over ceremony of medical proposed vehicles, medicine, health equipment, and so on, donated by the Chinese government to the Gambian government. This batch of donation amounts to about $10 million worth. My dear friend, as we all know, a novel coronavirus pneumonia outbreak was reported in China in December last year. At this moment, the Chinese government and people are still doing the efforts in combating the disease known as the COVID-19. Up till now, the outbreak has occurred in over 100 countries and regions worldwide. And the Gambia government is also working on preventing the coronavirus from entering into the country. At this critical moment, as the Gambia's sincere friend and partner, China decided to provide this batch of medical donation. I believe this reflects the valuable brotherly ties between our two governments and the people, both of our countries. I hope these materials could truly assist the Gambia in improving the public health capacity, provide health care to more people, and bring to the Gambia public more security and assurance in today's global health situation. Since the beginning of COVID-19 outbreak, the Chinese government put the people's health as its priority and adopted the most comprehensive and strict prevention and control measures. Many of these measures go far beyond the WHO International Health Regulations, the year 2005. At present, the daily new infection case number in China is declining. The number of discharged patients is rising steadily and quickly. With such positive trends emerging, China is even more confident in fighting the outbreak and has full capability and determination in keeping well controlling the outbreak and preventing its rebound. Meanwhile, in a responsible manner of openness and transparency, China has been in closely contact with the international society. WHO, ECOWAS, and many countries all commended the measures adopted by the Chinese government in containing the outbreak. The Chinese embassy also attaches utmost importance to relevant work. We instructed the Chinese medical team to adopt multiple measures to strengthen relevant capacity building and disease prevention work. We have requested Chinese citizens to postpone as much as possible their scheduled travels to the Gambia. And as the Chinese ambassador, I have met with Honorable Summit Minister many times, sharing information and coordinating on relevant work. China is ready to join hands with the Gambia, closely communicate and share outbreak prevention experience, help in relevant coordination work, and together contribute to the public health cause of the global. Ladies and gentlemen, China and the Gambia have a long tradition in cooperating in the area of health. In the history, China has dispatched a total of 15 medical teams, over 180 doctors to work in the Gambia, and has helped the Gambia build 4 health centers. Since 2017, the Chinese government has consecutively sent 3 medical teams to the Gambia, treating over 10,000 Gambian patients. We partnered with Edward Francis Small Teaching Hospital in co-building a gynecology center. We held the Brightness Action campaign, in which Chinese experts in treating cataract helped over 200 Gambia patients resume vision. Moreover, we have been supporting the Gambia government's HIV/AIDS sensitization activities, donating medical equipment and supplies to several Gambia hospitals, and sending Gambia health professionals to China for technical training. These measures are implementation of the Health Care Initiative, one of the 8 major initiatives announced by His Excellency Chinese President Xi Jinping in the 2018 FOCAC Beijing Summit. These measures are also an epitome of the China-Gambia friendship in the new century. To build an even stronger China-Africa community with a shared future is a consensus reached by Chinese and African leaders of the states at the 2018 FOCAC Beijing Summit. China upholds the principle of sincerity, real results, affinity, and good faith, and a right approach to justice and interests in its cooperation with Africa, and attached high importance to African countries' independent and sustainable development. Currently, China-Gambia relations are developing steadily and quickly. China supports Gambian government in its implementation of National Development Plan and its efforts in building the new Gambia, and is ready to keep deepening our bilateral cooperation in the area of health and beyond. We will coordinate with the Ministry of Health in carrying out activities to benefit people living in Gambia remote provincial areas, and to conduct a second Brightness Action campaign when the COVID-19 outbreak is overcome. We will further invite more Gambian health professionals and practitioners to training program to be held in China. I'm confident that under the guidance and support of President Xi Jinping and President Adam Barrow, and with the close cooperation between our governments, the Gambian public health will keep improving, health workers' ability will keep rising, and the people's health and the quality of life will be further promoted. Thank you very much. Thank you.
His Excellency Ambassador Al-Sheikh, thank you very much. That was a very good statement and a very encouraging statement indeed. I also want to recognize the presence of another friend to the Minister of Health, a very good friend to the ministry, by the name Samuel Mills, who is the World Bank tax team leader, who is here with us, and is also here with his daughter. This shows that this man likes the Minister of Health, and in fact want to see all the complex together with the daughter. So Sam, thank you for all the support for the ministry, and also thank you for bringing your daughter to our complex. And this shows that you really have the interest of the Minister of Health at heart. I now have for Dr. Desta, I don't need to, he's already a Gambian. I think I heard that he can speak Wolof now. He's now part of us, and then thank you, Dr. Desta, for the support you are giving to your brother, Honorable Lamin Samata. Since he came to office, you have been very supportive to him, and then we hope that this support will still continue. Our media family friends, we are now a family, and we continue this family relationship. And then from here, we're still going to engage you again on a very short press briefing. As you know, our press briefings in health are very, very short and straight to the point. So don't worry about time, we'll manage time. Alfang, I think you can attest to that, Alfang. Huh? So I now have the singular honor to invite the Honorable Minister of Health, Honorable Lamin Samate, to give his remarks with regards to this important handing over ceremony. I think I need to raise it.
Thank you very much, Ms. Sanjay. His Excellency Ambassador Ma Jianxun, Ambassador of the People's Republic of China to the Gambia, the WHO country representative, Dr. Dexter Tiruni, the National Assembly Select Committee for Health, the chairman, Honorable Usman Silla, the Permanent Secretary, Minister of Health, Mr. Muhammad Lamin Jaite, the Director for Health Services, Dr. Mustafa Bitey, our own brother again and special guest, Dr. Sam Mills, who is the Senior Health Specialist of the World Bank team and tax leader for the World Bank Health Collaboration. And as Ms. Sanjay said, Ms. Mills, who is here on a special visit, we say welcome to her. Our colleagues, the directors of all the units who are currently present here, pharmaceutical services, health promotion, the public health, and all the others who are probably sitting behind. Our special friends, the members of the Chinese medical team, who are putting in their efforts and struggling together with us in this country. Other team members of the Ministry of Health family, our special friends who send the messages of the Ministry of Health across to the entire world, the men and women of the media, we say to all of you, good afternoon. We are excited to be here this morning, but before I go further, let me mention that Honorable Silla was actually not late. In fact, he got to know about this meeting only 20 minutes before 10 o'clock, but he endeavored to come. It was an oversight. The people forgot to inform him, so I called him whilst I was on my way here. And he said to me, we have another meeting, but we'll endeavor to come. And we thank him very much for accepting our invitation just 20 minutes before the time. Thank you very much, Honorable. This is another very important step in the scheme of activities of the Ministry of Health, and a very important step when it comes to the collaboration with the People's Republic of China and the government of the Gambia, and more so with the health sector of this country. We have seen the commitment of the People's Republic of China and that of His Excellency Ambassador Ma Jianxun to the health sector of this country. We've seen all the input, the provision of medical personnel to this country, sending a very dedicated medical team to come and contribute to the healthcare service delivery in this country. We've seen the very committed Chinese team sitting right here who have left their families, who have left their comfort in China, who have come here to join with us under the heat, under the difficult conditions to provide healthcare services to our people. We commend them greatly for that. And you are all aware that this is not the only team. China has sent so many teams. This is the 15th team that is being sent to this country for the same purpose, and it should be well emulated, and we acknowledge that important fact. The Chinese government has contributed immensely to the socio-economic development of this country, but more so to the health sector, as mentioned by the ambassador. The Edward Francis Small Teaching Hospital has benefited immensely to the donations of equipment, to the collaboration between the gynecology department of that hospital and that of our sister hospital in China, to the capacity building, training of obstetricians and gynecologists, both here and in the People's Republic of China. Many consignments of equipment and drugs have been received over the period at the EFSTH, at Basse Hospital, and equally at Bansang General Hospital. Ambassador Ma, we want to inform you that all the items you've been providing have been put to very good use for the people of this country. Now we stand here again to show the people a consolidation of our efforts, especially during this coronavirus outbreak. We have partnered with the Embassy of the People's Republic of China to the Gambia in our collective efforts to the containment of the outbreak of the coronavirus disease in China and to the spread throughout the world. We had received very regular updates from Ambassador Ma at the Ministry of Health to give us detailed explanations of what is going on in China currently and what is going on around the world, and also the strategies that are being employed in China are shared with us to enhance our preparedness and to enhance our response mechanisms. And a lot of support had been given also during this period to make sure that the Gambia is prepared just in case we encounter the coronavirus on our shores. Through the ambassador, we thank the people, the government and people of the People's Republic of China for their leadership in their efforts to contain the coronavirus outbreak, to reduce the impact both in China and throughout the world. Coming back to why we are here today, about 4 months ago, we met with the Ambassador Ma and deliberated, we briefed him on the reform processes that the Ministry of Health is carrying out. The enhancement of the healthcare delivery system that the ministry wants to embark on. The improvement of the health facilities that we want to embark on. The upliftment of the quality of services that we want to embark on. We mentioned all to him and we told him our strategies. And part of those strategies, is the establishment of a health services monitoring team. The essence of this team is to go to all the facilities in this country at regular intervals and a lot of times unannounced to find out what is happening in our facilities across the length and breadth of this country so that the Ministry of Health could be advised as to what needs to be done in real time in each of our facilities. But also so that to put the people working in our facilities on their toes, that a team could arrive here any day to look at what is happening. And I think that is a very good initiative that the ministry, our teams put together to ensure quality service delivery for our people. When we mentioned this to Ambassador Ma, he said this is a wonderful idea. And we equally said this monitoring committee is also going to include people in the society, in the community, who are not working under the Ministry of Health, so that they can give liberal comments, they can give unbiased comments, unbiased advice as to what needs to be done. And this committee very soon will be in action and traveling around the entire country. Now, we said to Ambassador Ma, this committee needs a special vehicle that will be used to convey them to travel in the country unhindered so that they are able to give relevant advice, make relevant observations and give relevant advice. The second committee, well, the second vehicle actually is for visiting health teams. We frequently get people, Gambians in the diaspora, and other people, other friends of the Gambia who come to the Gambia wanting to offer medical services as part of medical missions, more so in the provinces, and transporting them to those sites is usually a challenge for us. We said we need a vehicle for such groups and also for our experts who are mainly based in the urban areas so that they also go into the hinterlands to provide services to the communities on outreaches on regular basis so that the service delivery to the people of this country is uniformly spread, enhancing access to quality medical services. These ideas were put forward to Ambassador Ma, and he was very excited, and he said to us, we will provide 2 vehicles for us. Thank you very much. Now, these vehicles were not manufactured then, and we gave them the input, what we want to be incorporated into these vehicles, how many passengers, the sirens, and so on and so forth. And they took notes, true to themselves, when it comes to diligence and when it comes to efficiency. They put all the designs, all our inputs, all our suggestions into these vehicles, and within a very short period, we got these vehicles in country to be delivered today. Ambassador Omar, we want to reassure you that these vehicles will be put to very, very good use. They will not be abused. They'll be maintained well. Ourselves will monitor the welfare of these vehicles on a weekly basis to make sure that they don't even have scratches, that the headlights are working, the seats are not torn, the engines are working, and they get regular maintenance. We assure you that. Because for sustainability and to make sure that we also are able to take care of other issues, we cannot every now and then have the good things we have worn out to such a level that we have to replace them every few years. Instead of getting more things, we keep on replacing and replacing, then Gambia will not be able to move forward. So we make sure that the items we receive are put to very good use, and we make sure that the maintenance culture is enhanced. Ambassador Ma again said, but we cannot give you vehicles alone for the purpose of carrying people. Those people need equipment to do their work. Those people equally need medications to provide to the people. And in addition, they provided all these cartons, all these boxes of very essential medications and very, very life-saving, very useful life-saving equipment in these boxes. We thank you for all these items. Today we are being presented with $10 million worth of vehicles and equipment. This is a very, very good gesture. That's a very kind gesture. And we want to thank His Excellency Ambassador Ma Jianxun and the government and people of the People's Republic of China. We appreciate it. We appreciate your partnership. We want to show you that during these trying times in the world, more so in China, the Ministry of Health, the people of the Gambia, stand by the people of China in these trying times. Our ministry stands by you, and we want you to extend our sincere gratitude and our message of solidarity to your ministry, to your people at these trying times. We also want to thank our partners, use the opportunity to thank our partners. The WHO country representative is here. He's been a true brother, a true partner, been giving us all the support that he can, through advice, through the messages, through the physical advice when it comes to international health, when it comes to international health regulations, when it comes to good governance in health. Dr. Tironi, we thank you very much. For Honorable Silla, he's a true brother of the Ministry of Health, but he's a personal special uncle of myself. Always supportive. I call him anytime he is there. He spoke about the special relationship between the legislature and the executive. Yes, ours is a very special one. But to let everybody know, it is based on principles. It is not because he likes Dr. Samata especially, or Dr. Samata and his team. But it is actually, of course I know he likes us, but I know it is based on principles. Because they have seen our vision. They know at the Ministry of Health, we insist on good governance, accountability, provision of quality healthcare services for the people of this country. And they know exactly that is what they want for this country. So then the friendship becomes easy, because what they want is what the ministry wants. And that's what the ministry is putting all hands on deck and putting all efforts to provide for our people. So that's what makes the friendship easy, because we all have the same vision. So collectively, we realize that we can work together, complement each other's efforts to get this health sector to where it needs to be, because the people of this country deserve the best when it comes to healthcare service delivery. They've stood by us, fought for extra budgetary support for us. They've advocated for support for us with partners. They have engaged partners to enhance our work at the ministry. They have done a lot of advocacy work at community levels, at committee levels, at the assembly levels, and each time they travel outside this country, a lot of efforts have been put advocating for the people of this country, more so the Ministry of Health. Thank you very much, Honorable Silla. But we certainly cannot also go without thanking Dr. Sam Mills. Ambassador Omar, Dr. Mills works with the World Bank, but he equally loves the Gambia. He is always with us. The World Bank has increased their funding level for the next funding cycle of the collaboration. World Bank has been very supportive. Dr. Mills is here working on the proposals with our people, supporting us, guiding us, and certainly the input of their projects have been felt in this country. We have all known the impact the RBF model has had in the health sector in this country, and we are on the verge of completing our proposal writing for the next phase of the funding cycle, so as to expand the coverage of the RBF project in the Gambia. Dr. Mills, we say thank you very much. We appreciate your good gesture. Of course, our entire team at the Ministry of Health, these things cannot happen without your participation, without your hard work. The Ministry of Health is one of the most complex ministries. When other people are resting and sleeping, we are on our toes. But that's the nature of our job, because the health of people can have challenges irrespective of the time of the day or night or the day of the week. So Saturdays, Sundays, midnight, every time we are on our toes, on the alert. So our work, if I'm allowed to say, I say with strong conviction, is probably the most difficult work. Ours is the most difficult job when compared to others. And certainly, we say gradually we enhancing our team at the Ministry of Health to improve on performance, because the people of this country deserve good quality services. So no compromises on performance. We need to deliver. So from the minister to every other person, we need to deliver. That's the message. We just need to deliver. There are no other options, and we have to come together. But I'm happy that our people are working very hard, the team in the ministry, to deliver. The message is getting across, and I have seen renewed commitment in the team at the Ministry of Health that I have never seen before. And we want to thank them very much. Ambassador Omar, before concluding, we are expressing our sincere appreciation. And I'll be happy if my brother, the media personnel, can allow me to have face-to-face with Ambassador Omar, because I can't see his face, to extend to him that we appreciate this gesture. This will go a long, long, long way to provide quality services for our people. And we have seen your passion, your commitment, your dedication to the people of this country. Once again, thank you very much.
Yeah, thank you.
Thank you.
Yeah,
thank you very much. Yeah. Thank you.
Okay.
Thank you. Thank you. Thank you. Thank you.
Wonderful. Excellent statement. handshake, appreciating each other's support. Thank you all for coming. Let's just have 2 minutes of signing. We now invite the President and Honorable and then we will hand over the keys. And we'll drive one of the vehicles.
That's yours, Thank you very much.
Have a seat, please. 烫屁股。
Thank you very much. Yo,
你的好，把这个旗弄好。这个东西拿开。
very good.
啊，好。
Thank you very much.
And we, the keys. This is the keys.
Okay, thank you very much.
Okay.
Thank you. Thank you.
My pleasure.
Appreciate it.
My
Yeah.
pleasure. Okay.
This is good.
Thank you.
Well,
So it's not easy to open the door.
well,
No, where is the guy?
who entered?
Who parked?
How to move the car? Oh,
Yeah, we'll move it now.
Okay.
Mas, Kalengeli.
So one of those doors, because those slide.
No, there is somebody who can enter, so you drive
它
out.
从后边钻进去是吧？
Mas, Kalengeli.
So the sliding door can open.
谁出风的人是谁？
Oh, this is good. Yo, yes. Yo, okay. So I'll give you this.
可以开出来那个，可以开we move the out. Have a look.
This one is move the
这
car
个
out.
哪个是哪个？按一下，按一下遥控器，哪个按键就可以开出来了。按一下。好，从那边进去这个。
Boy, get in the bagage, get in the bagage. Mas, Kai.
安全是吧？这开出来，往前开。好。
I can give you
Love like fire. Wow. Love like fire. Xam ngeen rek affaire bi xam ngeen fan la skincare la 2020 lañ wax de waaw fii nag mooy Kerr fan Kerr zero tache perfect skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu dee am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba la ka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi di waxee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw skincare plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indi les products